The qualification of an officer who may issue prescription for various classes of drugs is as per the EML. Drugs used in primary healthcare, dispensary and health centers can be prescribed by nurses and clinical officers. There are molecules that have good safety margin in terms of pharmacological toxicity, and they are therefore low risk of drug-induced complication. These drugs do not require specialist skill for administration.
Hospital-level drugs are used to manage complicated medical conditions that requires high level of skills to administer and close monitoring by specialist clinicians. The issuance and use of drug is therefore limited to facilities having medical officer and consultant in their establishment. Madam Speaker, question number 5 was the measure put in place by the county government to ensure ease and accessibility of the said medicine by the member of public. Madam Speaker, the Department of Health endeavors to avail the drugs required by the patients all the years round. In this regard, it conducts an annual qualification and selection of medicine on an annual basis. A project of the future needs is based on the consumption data of the preceding period. This informs the request done for funding. To ensure consistent availability of the supply, the department adopted a quarterly ordering system. The orders are sourced from the KEMSA admits, as this affords us quality and pricing guarantee. Madam Speaker, the drugs procured are delivered to each facility as requested, thus enhancing the efficiency distribution. To ensure seamless coordination of health product, the department established the Health Product and Technologies Unit that is charged with the day-to-day stewardship in matters health product. The unit has served to streamline medical supplies, to encourage effectiveness, monitoring of the utilization of the commodities. To further enhance the commodity availability in the facilities, the department has requested construction of several of the central drug store that shall hold adequate supplies buffer to ensure against unforeseen logistical hitches that may cause delay in procurement and distribution of drugs. Drugs in the envisioned that the construction of these critical facilities, complemented by the adequate budget, will enhance the provision and of the essential drug to our patient. Madam Speaker, the last question was to know the numbers of the health facilities with or without functional laboratories for diagnostic and clinical diagnosis of chronic diseases. Madam Speaker, there are currently 50 functional laboratories across the county. The scope of diagnostic capacities differ depending on the level of care, with the specialized diagnostic equipment being available in the hospitals and high volume of health centers. The rest have required basis diagnostic tests. The county is in the process of establishing more laboratories, with renovation works currently underway for Kajwire, Kahuru, Mutarakwa, Kidafai, Kiambogo, Captain, and Kwambe, Kenya. Laboratory works and equipping is complete and await recruitment of the officers to functionalize those facilities.
Madam Speaker, the execution of the committee terms of relevance. The committee was tasked with the activities to set out in the terms of relevance. The committee, with the support of the assigned secretariat, embarked on the responding and the short statement. Mr. Speaker, Madam Speaker, the committee undertook various observations. One, that the Department of Health Services has consistently been underfunded for years. This has contributed to disruption of medicine and non-pharmaceutical supply in the county health facilities. This has further led to outcry from the client due to unavailability of drug supplies in the county. Two, there is need to persuade the members of the public to get screened for non-communicable diseases like diabetic hypertension and cancer for easier management of this condition. Three, that there exists a gap in human resource establishment required to handle health commodities. More pharmaceutical personnel are thus required to optimally manage and oversee the same. Number four, hospital level drugs are used to manage complicated medical condition that requires high level of skills to administer and close monitoring by specialist clinicians. This issuance and use of drugs is therefore limited to facilities having medical officers and consultants in their establishment. Number five, that Kiambogo, Captain, and Kwambe Kenya laboratories are completed and equipped, but are yet to be operationalized, awaiting recruitment of laboratory technicians. Number six, the county has no central drugstore to cater for unforeseen eventualities that may cause delay in drug procurement and distribution. Madam Speaker, on conclusion, the county government should consider construction of drugstore that shall hold adequate drug supply buffer to ensure against unforeseen logistical hitch that may cause delay in procurement and distribution of drugs. It is envisioned that the construction of this critical facility complemented by the adequate budget will enhance the provision of the essential drugs to the patient. Mr. Speaker, Madam Speaker, I beg to give the statement. Thank you.
Thank you so much, Honorable Kagwe. It seems like the members are fully satisfied with the report sought by Honorable Gadongo and responded to by Honorable Kagwe on behalf of Gesha. Clerk.
Order number 8, motions and bills. Madam Speaker, we have a motion to be moved by Honorable Elijah Mwanginyaga, Leader of Majority Party.
Majority Leader, proceed.
Thank you, Madam Speaker. I beg to move the following motion that pursuant to Standing Order 29.3, the House does resolve to adjourn to a day other than the next normal sitting day, such that the House adjourns from today, the 25th day of April 2023, to resume on Tuesday, 2nd day of May 2023 at 9:30. Madam Speaker, tomorrow is a quite important day for our dear county, Nyandarua County, because we'll have a very special guest who happens to be the big boss, number one, within this country, the president, the honorable president, His Excellency, Honorable William Samoei Ruto, will be hosting him tomorrow. We have an occasion whereby he's coming to officially open the Tower Circle. And I think it is wise and prudent that we reserve that day for him, because I don't think it's wise to have a session when we'll be hosting the president of this country. So that's quite an important occasion, and the apparent reason why we are really having an adjournment. Madam Speaker, still, you look at what transpired during the morning session from the chair, who is the leading chair, Budget and Appropriation Committee. He came out strongly, saying that we are lagging behind time schedule, even as per the budget cycle. We need to fast track issues pertaining to the supplementary, ADPs, and many other. And he pleaded with the House that enough time be given so that we can pursue issues which are pertinent to this county. In that, I know very well that his prayer was we have a time as the whole, the committee of whole, so that we can pursue some issues pertaining to supplementary and ADP issues. So with that, I think it is wise that we have an adjournment, maybe until that is until the next normal sitting day, which will be Tuesday, 2nd May. Thank you, Madam Speaker, sir. And I'm calling forth for a seconder on the same, and I call Majority Whip Honorable Maria to second on the same. Thank you.
Thank you so much, our Majority Leader. Honorable Whip.
Madam Speaker, let me take this chance to join with my Majority Leader in welcoming all of us, to welcome not only the President of Kenya, but the party leader of the UDA party in which I serve. I second, sorry. Thank you.
Thank you so much. That is a motion that has substantively been moved and seconded. Do we have any contribution to that motion? Very well, thank you so much. Now I want to propose, sorry, before I put the question. Now I want to propose this motion that pursuant to Standing Order 29.3, the House does resolve to adjourn to a day other than the next normal sitting, such that the House adjourns from today, the 25th day of April, to resume on Tuesday, the 2nd day of May 2020 at 9:30. Thank you so much. Now I want to, put the question. Now I want to put the question that pursuant to Standing Order 29.3, the House does resolve to adjourn to a day other than the next normal sitting day, such that the House adjourns from today, the 25th day of April, to resume on Tuesday, the 2nd day of May, 2023 at 3:30 a.m. Sorry, I'm told it's May. Let me repeat that. That this House adjourns from today, the 25th day of April, to resume on Tuesday, 2nd day of May, 2023 at 9:30 a.m. Will as many as of the similar opinion say aye? Those of the contrary opinion say nay? The ayes have it and the motion has been passed. Thank you. Clerk?
Madam Speaker. Madam Speaker. Yes.
It's a bit unprocedural, but I'm going to use discretion one to find out what is the contention. The Honorable Whip from the Jubilee Party.
Sorry, we got ourselves confused in these standing orders after you have already resolved the houses adjourned. But there's an issue which is circulating. We want to confirm whether we are still hosting His Excellency Dr. President Ruto tomorrow.
Thank you so much. I'm going to use discretion number one to allow a minor debate on this matter. But I want to inform you, Honorable Whip, that when I propose a question, I propose the question for debate. So I breathe in and out for anybody, for me to catch anybody's eye. Then when I put the question, I'm finalizing on that matter. So I don't know whether this House has sufficient power to deliberate on that matter. I'm going to require a minute to consult with my clerk and the majority leader. Very well, honorable members. We have a substantive response to that matter. Tower Sacco is finally, doing a grand opening of their Sacco. His Excellency, the President, had already communicated that he's coming. So whether indirectly or directly, he is coming. Any other matter to that effect will be communicated informally. Thank you so much. Clerk?
Madam Speaker, we've exhausted the business as indicated in the afternoon's order paper.
Very well, thank you so much. Now, there being no other business of this sitting today, we adjourn the House to Tuesday, the 2nd day of May, 2023 at 9:30 a.m. Thank you so much.